A resistant starch is a form of our dietary fiber. It's basically a part of the big group of what we call carbohydrates. And the reason why resistant starch is so good is because instead of it getting digested in the small bowel where other starch and carbohydrates get digested and other fibers get digested, resistant starch, like its name, is resistant to digestion in the small bowel and instead gets digested in the large bowel. In the large bowel, we tend to get the benefit from the resistant starch where they can decrease some of the inflammatory markers. You can also have better digestion, just more colon health, they'll call it. There's also some benefit because they found that it keeps you fuller for longer. So they tend to find that people who eat higher levels of resistant starch tend to consume less calories throughout the day. So this is important, we're trying to battle obesity and, battle our hunger. If we ate more of the resistant starches, then we would feel more full for longer and hopefully consume less calories. Within most of our diets day to day, I think that we just need to be a little more conscious about the fiber category when we're looking at our food labels in order to see if we're actually getting at least fiber in general. What I would suggest for people to do is, for women, the daily recommended dose of fiber is about 25 grams per day. For men, it's about 30 grams per day. We just don't get that. So it's important to start maybe calculating and looking at some of your foods to see if you're getting anywhere close to what the daily recommendation is. And the hope is that consumed within that same category, there are some resistant starches that you would also be eating. Hopefully, the FDA will start to delineate between resistant starches and the other types of fiber so that it'll become part of our just daily labeling. I get a lot of people that want to just take a bunch of supplements, and while that's good, the whole point of it is a supplement. It's supposed to be it's supplementing what your daily diet really lacks. So what's better and what your body really responds more to is actually eating it in your dietary foods. You can then supplement what you're not getting enough of with the supplements, but then for the most part, you need to actually consume it through regular foods. First, I think the identification that you are a stress eater, and then sometimes there's ways of providing yourself with the foods that are accessible to you. And so if we can prepare ahead and you can have good foods and healthy foods in the house, that'll hopefully replace some of your eating with a healthier option. And then we can start combating some of the motivational triggers to go and eat when you're stressed. There's also some meditation techniques and other relaxation techniques that can help people deal with stress. And then, of course, exercise is huge in our ability to decrease stress and deal with our other things in our daily life much more adequately. St.Marks has a weight management program that is compiled of a multidisciplinary team of both physicians, such as primary care like family physicians or bariatricians, as well as bariatric surgeons, and then also the dietitians, which are like the core of the program. And they together help decide where the appropriate line of treatment is for every individual.
For more information about this physician or to schedule an appointment, please call our referral line or visit notbiggerjustbetterhealth.com.